Thank you for joining me today. I'm Dr. Steve Grinstead, and I'm really excited to be continuing my video blog series, and this is my latest. It's all about resolving the chronic pain and opioid syndemic. The goal here is to help people that have been getting poor service with the traditional biomedical model and find alternative ways to help them manage their chronic. For the last several years, this country's been in what's been called an opioid epidemic, an opioid crisis. I'm calling it a chronic pain and opioid syndemic. And it's much more than just the opioids and the chronic pain. It's also the coexisting mental health problems, especially unresolved trauma histories like post-traumatic stress disorder, PTSD. And like my colleague, Dr. Joe Cabaret used to say all the time, what we really have is a coping skills epidemic. People are not being given the tools and they're using a symptom management approach instead of a healing approach. You know, there's been a lot of research out that says that more than 30% of Americans have some form of acute or chronic pain. And in 2014, pharmacies dispensed over 245 million prescriptions for opioid pain relievers. A lot of them were diverted, misused, abused, and many of the primary care physicians and family medicine physicians were getting a little concerned about prescribing. It got pretty scary for them. And more than a third of the 44,000 drug overdose deaths were attributed to pharmaceutical opioids. And heroin accounted for an additional 19%. But over the past year, since this report, past couple of years, the fentanyl has been coming in. A lot of the street heroin has been laced with fentanyl, and now they're finding it in cocaine and methamphetamine. There's been a parallel increase in the rate of opioid addiction that's affecting about 2.5 million adults. And that's more than we have treatment slots for in the whole United States. Much of the current research is showing that the biomedical approach is not working effectively for most chronic pain patients who have coexisting problems such as medication misuse, abuse, pseudo-addiction, or addiction, along with other mental health problems like anxiety disorders, depressive disorders, but especially an unresolved trauma history like PTSD. And the big impact here is that 20% of the pain patients are using approximately 80% of the healthcare dollars, because using the biomedical approach, and what I mean by that is pills, shots, interventional pain procedures, and surgeries, is more about symptom management than healing and maintaining and increasing levels of functioning biologically, psychologically, socially, and spiritually. So we really need to look at how this problem's impacting and then start looking at the solution. We do have a serious problem. If you'll look at this photo, you'll see all the people lined up for the biomedical approach, pills and surgery. But you notice in the lane that says lifestyle change, nobody's stepping up. Nobody's stepping up to do the biopsychosocial spiritual lifestyle changes that are necessary to improve levels of functioning and quality of life. There's a synergistic treatment problem I coined the coexisting chronic pain syndrome. And what I mean by that is if you have a patient who has chronic pain, usually they're seen at first by their primary care physician, the emergency room, and then they're sent to pain management. Let's say that same person doesn't go there, but they have a problem with anxiety or depression, so they go to a mental health professional, and they're getting that dealt with. And then if they develop medication misuse, abuse, or addiction, they go into an addiction treatment program. What we have here is sequential treatment. And usually there's no communication or collaboration or coordination between the providers and the patient. And the problem here is 1 + 1 + 1 = 4 or more, that I call the synergistic effect. So this leads to the coexisting chronic pain syndrome. And what that needs is a concurrent treatment approach, working with the whole person. on all their issues. So the Synergistic Treatment Solution is the addiction-free pain management manualized system I developed starting in the mid-1990s and have finalized over the last several years in our residential chronic pain management program. In my new book, Thank You Adversity for Yet Another Test, I clearly outline what the addiction-free pain management manualized system is and how it enabled us to have some stellar outcomes with this complex chronic pain triple diagnosis population we worked with. So what we need is integrated, concurrent, targeted, and collaborative treatment with the patient being at the center. So when we look at pain, there's a biological component, the ascending signals that go from the pain receptors up to the thalamus. The signal that's saying, hey, something's going wrong here, better pay attention. Then how that gets interpreted is the meaning that gets assigned. How strong is it? What kind is it? How intense is it, etc. That's part of the descending system. But it also impacts people's family and work and everything. So then the role that gets assigned to the person in pain, they usually self-assign the role of I'm broken, I'm flawed, I'm defective, I'm a loser. And there's family and cultural beliefs that need to be taken into perspective. The other thing it impacts, and a lot of people don't even look at this, is the spiritual impact, where it's impacting people's spiritual values, practices, and principles, and they're out of harmony with those. So this is what the problem is. So the solution needs to address all those. And I see the spiritual as the glue holding the whole thing together. So there's many different things that have to happen. This is just a very finite number of interventions in each of the areas. So that people need to change the way their diet, nutrition, exercise, using other interventions like acupuncture, chiropractic, massage, yoga, tai chi, different things. In the psychological area, mindfulness has been a really big impact. Equine and pet-assisted therapy, neurofeedback, and biofeedback will help with the psychological problems, including trauma. Then we look at the social areas. This is teaching people to set assertive limits and boundaries, looking at how they can improve communications, and a lot of different things that can happen. And then the spiritual area is they need to be getting more in alignment with their spiritual values, practices, and principles. The first goal here when I work with people is to help them differentiate between religion and spirituality. So I always believe in moving onward and upward with hope. So I want to ask, what's the most important thing you learned by going through this video blog today? And what are 3 or 4 things that you can think of doing differently to improve your levels of functioning and quality of life in order to further aid the clients you serve? Or if you're living with chronic pain, how can this help you? What obstacles might you encounter, and how can you get help to overcome any problems? And most importantly, who are 3 appropriate accountability partners? What I mean by accountability partners, these are people you trust that you can share your goals with and help them help you be accountable to yourself to achieve those goals, to be a part of your team. So I really want to thank you for joining me today. And if you have any questions, please call or email me. If you're seeing this on my website, you'll have all the information. If not, go to www.drstevegrinstead.com and go to the contact page. Send me an email.